Supplements for your immune system, something very important. Here we are in 2020, strengthening your immune system, strengthening yourself against seasonal flu, cold viruses, and I group within that COVID-19 because it's the same thing. It's just a virus that we will eventually get exposed to, and we want our strongest immune response that we possibly can, keeping in mind, of course, that unfortunately those that are already immunocompromised or have some sort of what is called a comorbidity or chronic illness are the ones that have more difficulty with seasonal flu viruses, coronaviruses, COVID-19, whatever comes our way. Unfortunately, we know that our elderly get affected in nursing homes and so forth, and that's always been the same with seasonal flu in years past. Of course, with COVID-19, we've seen the same thing. So the good news is most of us will be fine, and 99.9% of us or better will be also fine when we get exposed. So we've talked in prior shows just recently about nutrition and the effects on the immune system. We talked about sleep, we talked about stress, we talked about exercise, and here we are, supplements and vitamins. And of course, keep in mind that supplements are exactly that. They are only supplements to all of the other health habits. They're not the main course, right? You can't out-supplement your way from a poor diet. It's kind of like trying to exercise enough so you can eat what you want. You might be able to get away with that for a while, but it's not going to work. So you need supplements are to add into all of the other healthy behaviors that we're doing. As we get into this, please keep in mind a couple of things. Never take any supplements without checking with your doctor. Specifically, if you're taking any medications, you want to make sure that there are no interactions whatsoever. So always check with your doctor. And if you have any symptoms at all after taking any sort of a supplement, stop immediately, go back to your doctor and talk to your doctor about that. Here's some quotes that I came across just today. This is the magazine Business Insider, September 17th of 2020. They did an interview with Dr. Anthony Fauci. Dr. Anthony Fauci is now a household name, right? Forget vitamins, Fauci says. The 3 best things to keep your immune system working optimally costs nothing. Dr. Fauci says this right here. Isn't that amazing? Here's what he says. For the general public, he recommends getting enough sleep, maintaining a healthy diet, and avoiding or alleviating stress as the 3 most potent ways to keep your immune system strong. Did you hear that on the headlines today or yesterday or the day before, or will you hear that tomorrow? Probably not. Isn't that amazing? Dr. Fauci, one of the leaders for our COVID response here, is saying the best things that you can do as an individual, as a family, as a community are things that cost nothing at all. We don't have to wait for the vaccine because the vaccine will save us. He's saying here, get enough sleep, maintain a healthy diet, and alleviate or avoid stress. That's awesome. Here's another article from pharmacytimes.com, August 26th of 2020. Now we're getting into supplements Supplements that contain higher than federally recommended levels of vitamin C and D may be safe, effective, and a low-cost way of helping your immune system fight coronavirus disease 2019, COVID-19, according to a study published in Nutrients. Vitamin C and D, more on those as we go along, and zinc and omega-3 fatty acids, fish oil, are critical for immune system function. Not eating enough of these essential nutrients can affect resistance to infection, increasing disease severity and burdens associated with the disease. Did you hear that on the headlines yesterday, the day before, or tomorrow? Probably not. Researchers from Oregon State University are urging the use of a daily multivitamin, more on that later, but also vitamin C and vitamin D supplements much higher than federally recommended guidelines, and I concur. The study authors recommended 200 milligrams or more of vitamin C, we're going to recommend more than that, and 2,000 international units of vitamin D, we're going to recommend more than that as well. And that's some interesting stuff. Fauci saying healthy lifestyle, cheap, boost your immune system. Recent studies out of the journal Nutrients and researchers from Oregon State University are saying vitamin C, vitamin D, zinc, omega-3 fish oil can help boost your immune system response to help yourself against any virus, including COVID-19. One of the reasons you don't hear this on the news is it doesn't make anybody any money. Okay? If I am a large pharmaceutical company and I come out with that first vaccination, we were just talking about this before the show started rolling, if I come out with that one and it's fast-tracked by the FDA and so forth to get there, and we make 1 billion doses or 2 billion doses, a few people are going to make a ton of dough. But a healthy lifestyle, nobody makes any money. These vitamins, are very, very cheap. Vitamin C, vitamin D are pennies per dose, and that's not going to make anybody any money. But that's why you're not going to see it on the headlines. Plus, it doesn't scare anybody, right? Here's ways to strengthen your immune system so you can fight viruses better. There's no shock and awe there, so it's not going to really sell newspapers or keep people on TV shows and websites and so forth. So as we roll into this, let's get into my recommendations here. Remember, again, there are some chronic disease and drug and medication interactions with some of these. I will point out some specifics as we move along, but please remember, talk with your doctor first before you start any new supplements. Okay, you can go to my website, drscottfuller.com, if you want to read more about these supplements here. First off, omega-3 fatty acids from fish oil, it's the top of this. Now, I have been doing omega-3 fish oil myself and for my patients for over 20 years, and I have seen unbelievable changes in people's health. Chronic pain improving or going away, brain problems getting better, from concussions to memory issues to ADD and ADHD and other associated attention and learning disabilities getting better. People, not with my recommendations, because I cannot do that with a chiropractor, I cannot give you any medication advice, but people getting off of their antidepressant medications with a program including omega-3 fish oils. I've seen that. People have talked about their immune system gets better. People have told me my skin, my hair, my nails grow better, and so forth. So extremely important. By the way, I wanted to mention this subject here, actually not this one, we're going to go to this one. This is Eat Fat, Get Thin by Dr. Mark Hyman. Great book, by the way, page 124. Increasing linoleic acid, which is an omega-6 fat. I'm going to call it the bad fat because we need less omega-6 than omega-3. Mostly from soybean oil. I will add to that any warm weather vegetable oil, soybeans, safflower, sunflower, corn oils, all of those omega-6 oils, okay? In the diet from 1960 to 1999 in 5 countries studied, predicted a 100-fold, not 1, not 10, a 100-fold increase in the risk of homicide deaths. Not only do these vegetable oils result in more heart attacks, obesity, and cancer, but they may make people murderers. Considering omega-3 fats make up much of your brain tissue, this makes sense because a high intake of omega-6 fats, the bad one if you will, interferes with the benefits of omega-3 fats, the good one. Another study on ulcerative colitis showed a 250% increased risk of inflammatory bowel disease in the group that consumed the highest amount of linoleic acid or omega-6. Dr. Hilbin says in his review that the increases in the world LA, linoleic acid, omega-6, the warm weather vegetable oils that I mentioned earlier, consumption over the past century can be considered a very large uncontrolled experiment that may have contributed to increased societal burdens of aggression, depression, and cardiovascular mortality. It's quite likely that most of the diseases of modern civilization, major depression, heart disease, and obesity are linked to the radical and dramatic shift in the composition of fats in the food supply from omega-6 to from omega-3, the good stuff, to omega-6. He goes on to say that increasing tissue concentrations of omega-3 fats, the good one, on a population level may result in a substantial decrease in healthcare costs by reducing the illnesses that account for the largest burden of disease worldwide, including COVID-19. I have seen this in my own practice in my small experiment, and imagine, as they're talking about here, if we just increase this to a population-based situation. However, that would require huge changes. We would only be able to make these changes if I was made the health czar of the United States with giving wide sweeping powers, then we would have to change farming. We would have to change soil. We would have to eliminate Monsanto's glyphosate Roundup. We would have to improve the soils. We'd have to go into organic farming. We'd have to do all the proper farming techniques with fertilization and not having the same crop in the same soil all the time. We'd have to move more to a plant-based diet and less of an animal-based diet. We'd have to shift from omega-6 to omega-3. It would just require a lot of stuff. It could be done. It could be done. If we had the will, it could be done. But I'd have to be the health czar with wide sweeping powers. I do recommend that you get your omega-6, omega-3 fat ratio checked. Probably your doctor is not aware of this, and that's okay. That's just the way that it is. It's not on standard blood tests. You do have to go to a specialty lab. You can look it up. We do it in my office with a little finger prick thing. You can do that at home. So, look that up. You want to know what that ratio is. I've talked about it about 5,000 times on this show and at different times. You want that ratio between 1 and 1 to 3 to 1, omega-6 to omega-3. Right around in there is the safe zone. When you get to 15 to 1, you're at the risk of chronic disease. The average American is 25 to 1. That's really bad. I've tested people. I have yet to see one person in my office have an appropriate, safe level of that ratio of omega-6 to omega-3 who's not already supplementing. I've yet to see that. I saw a child who was maybe 10 years old at 30 to 1. A colleague of mine, Dr. Murphy, had a medical physician coming into him who was 70 to 1. Improving that ratio, saw great improvements in that person's health. Infants, children, pre-puberty, they should take more DHA rather than the EPA. More on that some other time. You can go look that up. Those are the 2 omega-3 fats that we need. So again, infants, children in pre-puberty, they want more of the DHA for brain building. Adults want more of the EPA for anti-inflammatory effects, okay? So maybe 900 milligrams of EPA and DHA per day for that group. Adults, you should have a group of EPA, DHA, GLA, and ALA. You don't have to remember all of that. But EPA should double DHA in adults in most cases. Again, that might be too much for you to understand. Most omega-3 fish oils are already set up that way, but you can look into that. EPA should double DHA. 3,000 milligrams per day of omega-3 fish oil. And just keep in mind, you have to learn how to read a label. If a label says 1,000 milligrams on the front, very likely that's not what you're getting. You have to turn the label around. You have to look at those long words, eicosapentaenoic acid and docosahexaenoic acid. Took me months to learn how to pronounce those words. Anyways, love to do that in Scrabble. So if you look at those 2 big words and look at those milligrams, you have to add those up because that's what you're spending your money on when you get omega-3. And that's why liquid is always going to be better than gel cap because it's cheaper by usually half the cost. So you can order a variety of products. We have them and listed on my website and so on and so forth. So that's about the omega-3s. And in a moment, I'm going to get into the end of Alzheimer's with Dale Bredesen. And just keep in mind that he talks about taking enough omega-3 fish oils in there. So next up, number 2 is a blend of antioxidants. I call them omega-3 cofactors or antioxidants. If you go to my website, drscottfuller.com, you'll see a newsletter in there called Omega-3 cofactors. It's a blend of antioxidants. In there is B complex, which means that there are a variety of B vitamins in there. There's some C and some magnesium and some selenium and some glutathione and some CoQ10 and some alpha lipoic acid. These are all antioxidants or anti-rust. They fight rust in your body. Rust in your body is inflammation. Rust is oxidation. Rust is free radicals. Those are all the things that you've heard of that are in your system that create aging, that create chronic disease, that create DNA damage. All of those things, that's really bad. Plus, omega-3 fats are sensitive to oxidation. That's why you'll see omega-3s oftentimes, particularly in liquid bottles, they tend to be dark bottles and you store them in your fridge once they're opened. You should also store them in a cool place if you have a container that's not open because they're sensitive to heat, light, and oxygen. So you want to protect omega-3s that you're taking in with antioxidants, and that's why I recommend these blends, and I've been using those for many, many years. Now, some of my patients only just take the omega-3 cofactor product, just happens to be a company called NutraWest. Many of my patients have reported improved immunity, improved focus, fewer colds, better attention, better sleep with just taking those things, better digestion, better gut function, and so forth. Backing up a little bit to omega-3s, I've also found in omega-3s, same thing, better digestion as well. So that's why we take these antioxidant cofactors. Fighting free radicals, fighting rust, fighting inflammation, and protecting the omega-3s that are coming in from oxidation. Make sense? So that's number 2. You can see how that's going to boost your immune system as well. Okay, number 3, vitamin D. Now, Dr. Fauci, vitamin D. I have something here from him. Okay. We know that Dr. Fauci, he himself takes vitamin D. He takes vitamin D and vitamin C. He's talked about this in several news outlets and interviews. As far as I can see, he takes 6,000 international units of vitamin D per day. Somebody can run that down. I did have one resource on there, so that could be accurate, and that's pretty appropriate. I do recommend for the average person, vitamin D, that they should be taking 5,000 per day. Now keep in mind, and many of you watching this could experience this, if you get a blood test, and there's a lot of medical physicians that are now aware of vitamin D, so they'll throw it into your blood test. And if your blood work comes back, in the United States, usually the measurement is going to be nanograms per deciliter. You don't need to know that, but anyways, that's the units here. So it's going to be a whole number between 0 and 100. If you're 0, that's really bad, and 100, that would be too high, okay? So the sweet zone is 50 to 70, 50 to 70. That's going to be higher than what your little lab results are going to say, but I recommend it should be about that. And most people would agree about somewhere in there is about right, okay? So Dr. Fauci himself takes vitamin D, and he says that's okay to take. I do recommend, however, is that you get your vitamin D level checked, and just keep in mind, vitamin D is contraindicated in granulomatous diseases, such as sarcoid. If you don't know what that is, you don't have to bother, but again, granulomatous diseases such as sarcoidosis, if you have that, vitamin D is contraindicated. Any questions? Check with your doctor, okay? So you want to know what your level is, and let's say, once again, anybody that I've checked in my office or read their blood work, I have yet to see anyone with an adequate vitamin D level that is not already supplementing. Here's another one. And it's a worldwide deficiency. It's very well demonstrated. If you go to vitamindcouncil.org, you can read to your heart's content all about the research and the effects on the immune system and the effects on chronic diseases and cancer and heart disease and diabetes. And every cell of your body needs these hormone D. It's actually more of a hormone than it is a vitamin. So there you go. Here we are in the Boston latitude where I'm taping this show, where we only have 4 months of adequate sun that can produce vitamin D. That means 8 months we're getting 0. So that means we're already deficient. And that's why in the Scandinavian countries, vitamin D supplementation is just something that they just do because they know the problems there. So know what your level is. And again, for some of you that have been tested low, you know that you're probably getting injections of vitamin D at 50,000 international units, sometimes once a week for months. Well, I say spread it out because I think your body can handle things that are spread out over time. As an example, do you want to get 10 minutes of sun 7 days a week? Or do you want to get 70 minutes of sun 1 day a week, right? So it's the same thing a little bit all the time makes a difference, I think. Infants can get 400 IU per day, pre-puberty 2,500 international units per day. The quick formula is 1,000 international units per 25 pounds of body weight. So the average adult does fine at 5,000 per day. Get yourself pre-tested and retested. I have 3 vitamin D newsletters on my website, drscottfuller.com, so you can check those out. Okay. Number 4 is vitamin K24 and K27. Here's the quick thing about vitamin K. Vitamin D, as you know, is intimately involved with the metabolism and structure of bones and getting calcium to bones and so on and so forth. Vitamin K, especially vitamin K24 and K27, give calcium the direction to go to bone and stay away from soft tissue. Go to bone and stay away from soft tissue. So vitamin D will help with the absorption and assimilation. Vitamin K gives you direction. And that's why vitamin K is very important. Just keep in mind, if you are on a blood thinner, do not take any vitamin K until you check with your doctor, because there are some mild blood thinning capabilities of vitamin K. The same with omega-3 fish oil. Omega-3 fish oil has some mild blood thinning capabilities. Again, check with your doctor and make sure that that is fine. So there are a variety of vitamin D supplements out there that contain vitamin K built in. We have those in my office. I separate the D and the K for some people, and other people I just have them taking vitamin D and vitamin K together. It just makes sense. So that's important there. Next up is zinc. Now zinc, as you know, has made the headlines with COVID-19. Zinc has been around for many years. It's been in the awareness for people for decades for cold prevention, immune system fortification, seasonal flu, COVID-19 protection and so forth, getting that immune system a little bit stronger and so forth. Why not, right? So zinc, I recommend taking 20 milligrams per day. That makes sense to me. 20 milligrams, I think taking more than that might be a problem for some people. So look at that. A little bit about zinc here. So I did a quick online search on zinc before I came in. I went to PubMed and I put in these words, zinc and immune. That's all I put, zinc and immune. I came up with 5,400 results. Not to say that all 5,400 of those results will be specifically zinc supplementation and human immune system response, but it is indicating that there's a lot of literature. Here's one here that I came up with. I just want to mention this one quickly. Zinc in human health, effects of zinc on immune cells. Sounds pretty neat. By Ananda Prasad out of Molecular Medicine Journal 2008. The essentiality of zinc for humans was recognized only 40 years ago in the Middle East. Zinc deficient patients had severe immune system dysfunctions. They documented problems with immune dysfunctions mainly with T helper cells. That sounds pretty important. Neurosensory disorders, decreased lean body mass, cognitive impairment. And it got very technical, but some of these words that I'm saying to you now are probably starting to make sense because you're hearing about these in the news reports as we're talking about the immune system and boosting it and COVID-19 and so forth. Research shows a decrease in gene expression of interleukin-2, decreased NF-kappa B due to zinc deficiency, decreased binding of NF-kappa B to DNA. That sounds pretty important, right? Decreased levels of NF-kappa B messenger RNA. And again, you've heard about RNA particles and DNA and all these things with the research regarding COVID-19. Therapeutic roles of zinc for acute infantile diarrhea and treatment of the common cold have been reported. Again, there's that association of taking in enough zinc, and there we go. Zinc and immunity in this same article. Zinc affects multiple aspects of immune system function. So there you go. There's good evidence. You can do a Google search if you want to, putting in zinc and COVID, and you'll see a bunch of articles. Some saying there's not much research or association out there. Others saying, you know, there is enough association between zinc and human immune system function. Maybe taking a little bit would be a good idea. So you could look at that. Look at zinc. Again, it's extremely inexpensive. Then moving on next to vitamin C. Vitamin C. Now in the cofactor stuff that I talked about earlier, there is some vitamin C, but I think it's worthy for people to experiment taking more vitamin C than just 200 milligrams or 500 milligrams. A lot of my patients are taking 1,000 milligrams per day. I'm at least doing that. I definitely up mine in the winter months. And by the way, I just came across this as well. There is this government website in the United States, COVID-19 treatment guidelines.nih.gov. COVID-19 treatment guidelines.nih.gov, National Institutes of Health. There's a section in there called adjunctive therapy. Good for them. Okay, I'm glad they put it out there. They had vitamin C, vitamin D, zinc, and something else. I can't remember, but they had 4 vitamins listed in there. A couple of them they said they're not making any recommendations, but they are saying vitamin C is a water-soluble vitamin thought to have beneficial effects in patients with severe and critical illnesses. It's an antioxidant and free radical scavenger that has anti-inflammatory properties. influences cellular immunity and vascular integrity, and serves as a cofactor in the generation of endogenous catecholamines. This is sounding pretty important, isn't it? Because humans may require more vitamin C in states of oxidative stress, vitamin C supplementation has been evaluated in numerous disease states, including serious infections and sepsis. Serious infections, vitamin C. There's a strong link. Because serious COVID-19 may cause sepsis and acute respiratory distress syndrome, or ARDS, the potential role in high doses of vitamin C in decreasing inflammation and vascular injury in patients is being studied. So they're not coming out and saying, take your vitamin C, but boy, that is one powerful paragraph right there for taking more vitamin C, I think. By the way, before we run out of time here, The End of Alzheimer's, don't miss this book, Dale Bredesen, The End of Alzheimer's. He has an exercise section, a sleep section, of meditation, mindfulness recommendations, all kinds of nutrients and exercise specific things. And of course, he has a bunch of supplements that he recommends for the brain, for brain health, and for reversing Alzheimer's. Vitamin B, B complex he talks about in here, many of the Bs. C, D with at least 25 IU, international units. Vitamin E, K, there's K again. Resveratrol, acetyl L-carnitine, CoQ10, omega-3 fatty acids. Then he has a variety of herbs that he recommends here as well. So he's talking about these brain-based nutrients. Improve your brain, and what is the number one control of everything in your body is your brain. Better brain, better immune system regulation, better blood flow to your organs, better immune system, and so on and so forth. In The End of Alzheimer's, he's talking about the same stuff. That's a pretty significant list of nutrients. A couple more. Magnesium is next. Now, I've done a couple of programs on here on magnesium. Go check those out. If you missed my shows on magnesium, go to my YouTube page and check out my shows on magnesium. It's just awesome. So magnesium is generated by almost every cell. It's needed by almost every cell. Any cell that's producing ATP except for a red blood cell. And so the energy producing ATP cycle, Krebs cycle in your mitochondria of your cells is very much magnesium dependent. And if you have a deficiency of magnesium, which is also very, very common, then you're going to not have enough energy for your cells to do the functions that they need to, at least at an optimal, ideal situation. And that's why so many people with magnesium deficiency have heart arrhythmias and heart symptoms. They have muscular cramps and imbalances. And then I've seen it involve digestive system problems and brain issues and so on and so forth. And that's why so many brain trauma situations require magnesium. So I recommend magnesium. Anywhere from 300 to 900 milligrams per day is completely safe. One side effect that some people get, depending on the form of magnesium, is loose stools. So just kind of keep that in mind. So maybe you titrate up slowly, but you've got to watch my video because there's a couple of forms of magnesium that you do not want to be taking: magnesium oxide and magnesium aspartate. And I'll tell you, people have sent me, hey, how does this one look? And I'm like, send me a picture of the ingredients list. And sure, if I see magnesium oxide or I see magnesium aspartate, I'm saying stay away, stay away. And lastly, you can look at probiotics, remembering that 70% of your immune system is involved with your gut and the microbiome of your gut. There are more bacteria in your gut than there are cells in your body by a factor of 2 at least, if not a factor of 10. So there are, some say 100 trillion bacteria in your gut, or should be. And if there's not, then that's upsetting the microbiome. That's upsetting your relationship between food inside your gut and the gut wall and the bloodstream. And that's involved with leaky gut and so on and so forth, and being able to break down foodstuffs and get your nutrients in. So oftentimes people will do well with prebiotics and probiotics. So look into those if you want to as an adjunct here. So as review, there are several supplements as a supplement to other good lifestyle habits, like Dr. Fauci said, as healthy diet, regular exercise, reducing stress, getting enough sleep, going to the chiropractor. I don't think Dr. Fauci said that, but I did. Going to the chiropractor, taking care of your spine and your nervous system. And then, of course, supplements. Omega-3 essential fatty acids, number 1. Cofactors, number 2. Vitamin D and vitamin K, look at that. Zinc, vitamin C, magnesium, probiotics. I'm Dr. Scott Fuller. Thank you.